Well, hey everybody, my name is Christie Kirkpatrick Schmutz. I am an internal medicine physician at Kirkpatrick Family Care, and I am joined by my older brother, Scotty Kirkpatrick, who is initially also an internist, but now a cardiologist, also at Kirkpatrick Family Care. So today we're going to talk to you a little bit about how metabolic health can help you live your dream life. So Scotty and I are really passionate about working on health in ways that we can make sure that you're getting to do the activities you love as you get older and even now. So, Scotty, can you talk to us a little bit about what metabolic health is?
Yeah, so metabolic health is, I wish there was a simple definition for it. It's sort of complex, but I think on a very basic level, I sort of think of it as how well our body does at producing fuel or energy. And I think a simple way to imagine that is, let's take someone and have them eat a random bowl of ice cream. You can imagine that their blood sugar would increase from that. Eventually, or hopefully for most of us, our blood sugar will come down as our body produces insulin and does a lot of other things to process that sugar load that we just got from ice cream. But for a very metabolically fit person, that may be a very quick process. They eat a bowl of ice cream and boom, their body just, uses it up like that, and their blood sugar is back to normal in, you know, a pretty quick amount of time, and they didn't need a ton of insulin to be able to do so, etc. On the other end of the spectrum might be someone who eats that bowl of ice cream and either their blood sugar is already elevated from the last time they ate anything, but it takes them their blood sugar gets very, very, very high. They need tons of amount of insulin in order to try to bring that blood sugar down, and their body is resistant to that, so it takes a very long time for their blood sugar to come back down to normal. And some people, like with type 2 diabetes, which we'll get into in a second, they never actually get back to normal. And so you can see that those two different people process that ice cream, if you will, much, much different. And um, because of that different sort of processing capabilities, those two people are at very different percentages for what their risk of future outcomes are for things like cardiovascular disease, dementia, all sorts of bad stuff.
Okay, so it's how well our bodies can process the energy we take in and insulin, the hormone that brings sugar into our blood. How well does that work? How much are they making? And then all of that kind of influences health outcomes.
Yeah, that was way better said than what I said, but yeah, that's exactly right.
Okay. Well, how is the US doing? Like, what percentage of US adults are doing well in this
Yeah,
metabolic health arena?
Not not well. So if I were to tell you that 50% of the United States population was metabolically healthy, I would be lying to you. It's actually way, way, way worse. So 88% of people in the United States that are adults, 88% of US adults, which is about 227 million people, are metabolically unhealthy. So there's only 12% of US adults that are metabolically healthy. And as we relate this back to this topic of, living your dream life, if you're metabolically unhealthy, you're at way higher risk for dying early from any cause. You're at way higher risk of dying from cardiovascular disease or having cardiovascular disease that impairs your ability to do the things you like heart failure or coronary artery disease, heart attacks, things like that. Even if you don't die from them, you may just not be able to do the things you want to do because of those things. Kidney disease, huge risk factor for ending up on dialysis is diabetes. And some people have even hypothesized that maybe even cancer could be a cause as well. And as we'll get to in later talks as well, liver disease with fatty liver. So you're at risk for all these different things that may cause you to die sooner and also live a life that's not really what you would hope to. And
Hmm.
88% of the population that are US adults are at risk for that happening to them because they're not metabolically healthy.
Wow, it's sobering. Um, and at the same time, I think probably people won't be super surprised, you know?
No, I think you're right. But I think you're probably right, but then I think, a lot of times, people assume that it's people that might look a certain way, and certainly they're more
Hmm.
likely, but there's plenty of people who you would be surprised are not
Yeah,
metabolically healthy that are not metabolically healthy.
yeah, totally. How can you talk about how this is measured, how we measure metabolic health?
Yeah, so there's a variety of ways, we'll talk about some. I like to do a lot more testing than what we're going to talk about today, but just for the basics. Um, Obviously, there's a blood test called the A1c, and that A1c says over the past 3 months, what's your average blood sugar been? And there's a conversion rate, and it gives you a number. And so that's very good for diagnosing diabetes. And if you have diabetes, you are metabolically healthy. If you have prediabetes, which that A1c test is also the gold standard for testing, then you are metabolically unhealthy. But even before you have diabetes or prediabetes, there are other tests that can be abnormal that indicate that you are metabolically unhealthy despite your A1Cs being normal. So a more comprehensive way to look about this is something called this metabolic syndrome. In order to diagnose metabolic syndrome, you need 3 of the following 5 things to be abnormal. So you would need a blood pressure that's greater than 130/85. As a side note, that's not even
Yeah.
optimal blood pressure,
Yep.
but they just use that for a cutoff. You need to have a waist circumference that's 40 inches or more for a man, or 35 inches or more for a woman. Having a fasting triglycerides greater than 150, having a fasting blood sugar greater than 100, and then having an HDL cholesterol that is less than 40 for a man or less than 50 for a woman. If you have any 3 of those things, you have metabolic syndrome, which puts you at higher risk for lots of things, including cardiovascular disease, which obviously I'm very passionate about. But any one of those markers puts you at risk for
Mhm.
having cardiovascular disease as well as a lot of other things. So only 12% of the population that are adults in the United States can say they have 0 of those 5 things I just mentioned. And so that's where this number comes from. 88% of people being metabolically unhealthy is because when we look at the 5 components, of which you need 3 for metabolic syndrome, 88% of people have at least one of those. And even if they don't have metabolic syndrome and they just have 1 or 2 of those, they're at increased risk for a lot of things.
Do you know, like, what about people who, let's say they have high blood pressure, but it's now controlled on medications, or they have high cholesterol, but it's now again controlled on a medication? Does that modify their risk, or does it just keep them in the elevated risk range?
No, it definitely does. I mean, I think one of the things though that I'm really passionate about is time. Because someone who's had, let's say, high blood pressure for 50 years, and just now we got that blood pressure control. That's a very different story than someone who's 30 and realized a year ago they have high blood pressure, and now we get under control. That
Hmm.
stays under control for the rest of their life. So, we're going to talk a lot about numbers from this video through other series of videos. But another thing that's really important is time. So it's not just about getting the numbers normalized, it's the amount of time you do, and the longer that you control that with medication or lifestyle or whatever to get that, you're definitely way better off than the person who got it controlled at the last second.
Yeah, that totally makes sense. Yeah, and kind of, I guess, related on that, talking about how like the numbers that we check sometimes, like the A1c, may not show the beginnings of metabolic syndrome. And so, can you kind of talk about that more? And I think there's some graphics we can show that would be helpful.
Yeah, for sure. So people often are surprised to hear like, "Oh, wait, I'm metabolically unhealthy. Well, my A1c is normal." So if I show you this graph here, I think this is a really good depiction of what this means. So if you look here, when we're seeing that our A1c is abnormal, as I said, that looks at blood sugar. How high is your blood sugar? And as you can see on the very end of this spectrum over here, or this table, that's when we start to see our blood sugar be high and we get diagnosed with diabetes. But well before that, we can see our blood sugar rise a little bit, and that's signs of prediabetes. But even before that, when our blood sugar is still technically normal, we can be metabolically unhealthy because we are needing higher levels of insulin, which, as you can see in this yellow graph, to achieve this normal blood sugar. So even though our blood sugar looks normal and our A1c looks normal, it looks good, looks good, the amount of insulin we are needing to produce to keep that blood sugar normal is increasing. And that means, as shown in the red line here, that we are becoming more and more resistant to the effects of insulin. So basically, this may be complicated for some, but what it's basically saying is your blood sugar being abnormal, which is what the A1c looks at, that is a late marker of metabolic
Hmm.
dysfunction. And there's other tests like the 5, criteria that we've just talked about, or even other tests as well that we won't get into today, but that I like to test people for, where we can say, hey, I know your blood sugar looks normal, but in the next 5, 10, 15 years, you're probably going to be pre-diabetic or even diabetic because you have signs of insulin resistance that's occurring earlier, and you're taking more and more insulin to keep your blood sugar normal. And so I think we're doing a disservice to people if we just look at the A1c and say, hey, blood sugar is normal, you're metabolically healthy. I think that's false assurance a lot of the times. I think we owe it to patients to tell them where they're truly at, and that takes doing some of these other tests.
That's so good. Yeah, I think too, if we're, we talk so much about prevention and everyone's interested in that. And the A1C, while it's a super helpful test for
Hmm.
diagnosing, managing diabetes, it's
Yeah.
just not helpful in terms of prevention. I mean, can be, if it's pre-diabetic range, but there's just so much more than that, like you've said.
Yeah, someone doesn't overnight, you get your blood checked,
Yeah.
1 year you're normal and the next year you're pre-diabetic. That didn't happen in that year. That's been going on for years most of the time, where we could have said, "Hey, you're approaching this. I know the numbers look okay, but if we check
Hmm.
these other things, it's telling us that underneath the iceberg, if you will, there's problems brewing."
Yeah. Okay, so let's get back to like the whole reason we're talking about this is because we want people to live better lives, doing the things that they love for a longer
Mhm.
amount of time. Um, how does metabolic syndrome fit into that? How does it impact that goal?
Yeah, let's first talk about quality of life. I mean, it doesn't take a genius to understand that if you have a stroke or you need dialysis or you have a heart attack or have heart failure, all of which poor metabolic health, and it's particularly diabetes and prediabetes, can increase your risk for it. That's going to limit your ability to do things you like to do. If you have a stroke, you may not be able to use a body part for the rest of your life. If you're on dialysis 3 days a week, you have to be at a center getting dialysis for multiple hours. If you have heart failure or heart attacks, you may not be able to do the things from a cardiovascular fitness level that you want to do. So, from a quality of life, this absolutely can negatively impact your quality of life. Additionally, number one reason why people get limbs amputated, diabetes. Number one reason why people go blind
Yeah.
is diabetes. So this is a huge, huge issue just from a quality of life.
Yep.
But if we go, a step further, which is talking about, how do we? Let's see here. Sorry, I'm trying to share my screen. How about how long do we live? And that is also impacted by the fact that if we have diabetes or poor metabolic health. So if I look here, sorry, bear with me. There we go. So if you look at this graphic here, this basically shows that um, if you have any one of those 5 components, so you are at increased risk for cardiovascular death. So they looked at this group of people. They said, let's see how many of these 5 things that we talked about earlier do you have that represent components of metabolic syndrome, and over 13 years, what's your risk of dying from cardiovascular disease? And these are all compared to people with 0 of those 5, so the 12% of people that are metabolically healthy. So if you look here, if you had 1 to 2 components, so I mean your blood pressure was high, you had high triglycerides, you had high fasting blood sugar, your waist circumference was large, or your HDL was low, if you had any 1 or 2 of those, you had a 71% higher risk of cardiovascular death over a 13-year follow-up from people who were 0 out of 5. Now, let's say you had 3 of those 5 things. That means you have metabolic syndrome. If you are one of those people that has that, but not yet diabetes, you are at 132. That's what this 2.32 means. It's 132% increased risk of cardiovascular disease over a 13-year follow-up than people without that. And as we go up and we get more metabolically healthy, now you don't just have metabolic syndrome, now you have diabetes. Well, you're at a 263% increased risk. Now you have metabolic syndrome and a history of cardiovascular disease, you have even more risk. Now you have metabolic syndrome and cardiovascular disease and diabetes, you're at even higher risk of dying from cardiovascular disease. So this is all to say that your chance of dying from cardiovascular disease, which is the number one reason why people die, significantly increases the more of these components of poor metabolic health you have. So even when we're at the 1 or 2 components of metabolic syndrome where we don't quite have metabolic syndrome yet, but there's some kind of signs there, you are at higher risk. We need to get that addressed ASAP.
I think the cool thing about this too is like looking at that graph, you don't have to pull it back up, but like there's such an exponential increase as you go up, but that also you can deduce that there's a big decrease if you can modify those risk
Mhm,
factors. And so many of the components of metabolic syndrome, we have lots of things to do about. We have great treatments for weight loss to treat waist circumference. We have
mhm.
great treatments for hypertension, for lipids. So this would be super depressing if it was like, this is where we're at and there's nothing we can do about it. But the exciting thing is there is so much we can do about it.
Yeah, I totally agree. I mean, there's some things that, I don't know why we get certain types of rare cancers or things like that that we have no power over
Yeah.
to our knowledge yet. But cardiovascular disease, the number one reason why people die, we have tremendous power over this. And as you said, whether it's weight management to improve your metabolic health, or lifestyle changes to improve blood pressure,
Hmm.
or medications or lifestyle management to help with cholesterol, blood pressure. There's so many things we can do.
Hmm.
It just takes working with your doctor and working with your team to get those numbers on the right track.
Any other thoughts about like treatments or things people can be doing to work on these things?
Yeah, I think the most important thing is just to start early. We're all at risk. Clearly, if 88% of the population is metabolically unhealthy, most people listening to this are going to technically fit that category. So it takes a look in the mirror and say, hey, I need to go get checked. I need to see if I'm truly
Yeah.
at risk. And then coming up with a plan. Like I said, our ability to check early, work with a team. There's a lot of different things that we can do, whether that's lifestyle or medication or the combination of both, to lower your risk of cardiovascular disease or a lot of other problems. And so it's really important. But I think that maybe the most important thing is to start now. And
Yeah.
and the reason that I'm so passionate about starting as early as possible is because obviously your risks increase even if you have one or two of these components, and definitely if you have metabolic syndrome. But also, to just be honest, part of the game is about just not getting diabetes in the first place, because if I show you here, on this graph, every decade in life that we are diagnosed with diabetes, every earlier decade. So if you're diagnosed at 30 compared to 40, or 40 compared to 50, or 50 compared to 60, etc. For each decade of life that we are diagnosed earlier with diabetes, we on average lose 3 to 4 years of our life. So that means, if you can see in this graphic here, if you're a 30-year-old and you're diagnosed with diabetes, on average, compared to someone who's never diagnosed with diabetes, you're likely to live about somewhere between 14 to 16 years less than someone who's never diagnosed.
Oh,
At age 40, if you get diagnosed with diabetes, you're somewhere between your life expectancy is cut down by probably 10 to 12 years. How about 50? Well, somewhere between 6 and 7 years that you're, likely to have a shorter life by 6 or 7 years because you got diagnosed with diabetes earlier. And each year it decreases by 3 to 4 years. But this is I feel like just alarm bells should be going off in people's heads, because if you're 30 or you're 40 and you have pre-diabetes, which means if things continue, there's a very good chance you're going to get diabetes in your 40s or 50s. Then you're looking at, hey, on average, compared to someone who never gets diabetes, I'm looking at, 6 to 7 or 9 to 10 years of life on average that is shortened because I had diabetes. So that is like, we need to start early, because we need to
mhm.
start lowering our risk now. And what I don't show here, but what they show in this paper is that if you do become diagnosed with diabetes, if you aggressively get that under control, it's not a death sentence, but the earlier you get on top of that, even if you're diagnosed with diabetes, you start to see improvement. But the harder and the further along we get on this path of sliding down into diabetes, the harder it gets to correct, which is why we need to act now and take it seriously. You know, we need to care about our metabolic health. If you want to live your absolute best version of life in this one life that we get, you absolutely need to take control of your metabolic health to shift the odds in your favor, or else you're putting yourself at not only just risk of living a lot shorter, but having severe disability that could really compromise your life.
Totally. And I think also like we get that like our main thing is we want people to come in. We want people to feel safe to come talk to us about these things.
Yes,
We get that life sometimes has happened. It doesn't matter
a
what's been
hundred
going on the
percent.
last 10, 15, 20 years. You may have been facing like incredible challenging circumstances, and that's okay. Like
Mhm,
it, if you come in to see us, or hopefully if you go in to see another healthcare provider, like the goal is not to shame you for all the things you
mhm.
haven't done. It's how can we take the bull by the horns now,
Yeah.
and like help you going forward. It's so many things may have happened in the past, but like we're really talking about here and now. We start with a blank slate, just trying to do what we can to get you healthier.
Yeah, that's such a good point. I think a lot of times there is kind of, people almost might feel shamed that they,
Yeah.
or get shamed by providers
Yes.
and doctors that they have diabetes or poor metabolic health. But clearly, if 88% of the population has markers of poor metabolic health, it's not your fault. Like, um, the way our society lives and runs right now, it is clearly geared to make us metabolically unhealthy.
Yeah.
So we're hoping that by, working with us, we can help people kind of fight back against that. And like I said, even if we don't, you know, cure you completely, even if we just delay things, that's half the
Yes.
battle. So it is not your fault. Our society and our world is fighting against us to achieve good metabolic health, and we want to help you fight back.
Totally. 100%. Great. Any last takeaways, Scotty?
No, I just think, like I said, we're happy to see anybody for this. We're clearly very passionate about this. But even you don't have to see us. Go see your doctor. Just get
Hmm.
checked and take it seriously. I think a lot of times, people will be told, "Hey, that looks fine. You're good. Don't worry about it." But dig a little deeper. Let's see if there's something in there that we can uncover to see that, maybe there might be problems down the road, because life is worth it. It's totally
Hmm.
worth it. So it just takes starting. The first step is the hardest. So contact your healthcare provider and see if you can get tested to see if you have metabolic health that's in the right range or not. um, the sooner you start, the better.
Awesome. All right. So, everybody, keep an eye out on our social media feeds for more videos on how we can help you learn to live a better, longer life.